Hello everyone, welcome to October's FHUSE Webinar Wednesday. I'm John Hirst, I'm the FHUSE Finance Director, and it's my pleasure to host today's webinar. We've got a pretty full agenda today, so we'll get started straight away. There'll be a short update from the FHUSE board to start with, and then I'm going to hand over to Michael Harris, and he's going to talk through the FHUSE EU Connect, which starts in just a couple of weeks' time. And then Beate is going to present on a new project that we have, the Knowledge Repository. And then Zach and Mary will present on sharing an interactive display in an FDA submission pilot. And then finally, Hanming is going to present on the TS domain. He's going to give us a demo of the TS domain. So first of all, our FHUSE Board of Directors update for this month. I'm going to start off by talking about the EU Connect, which you'll obviously hear a lot more about in a few minutes' time from Michael. Registration is still open for that event, so if you can attend, then please register soon. It promises to be a really great event. We've got more than 600 participants attending now. A nice big exhibition with 38 exhibitors. And also new for this event, we've got the new PHUSE App. This is available to everybody, but only those who are registered for the event will have access to the app for that particular event. And one plea from me is just make sure you use the same email address to register for the app that you did to register for the event, just to make sure that it all works for you when you do download it. Also, registration is now open for the next US Connect event. This is going to be in March next year in Orlando. We've still got some sponsorship and exhibitor opportunities available, so if you're interested in sponsoring or exhibiting, then please do get in touch. New for that event is going to be the FDA Innovation Challenge, so please watch out for more announcements about that and the Orlando event in the coming few weeks. We've also got 2 single-day events happening in November. We've got one on the 1st of November in Shanghai, and then in Bloemfontein on the 29th of November. So if you're interested in either of those 2 events, then please do register as soon as you can to make sure you can book your space. In the working group space, we've got quite a few things going on at the moment. So the first of those is a deliverable that's now out for public comment. So this is the best practices and for quality control and validation. Public comments close on the 15th of November. So please do go and take a look at that and make some comments to the team. Also, the KPI Year 2 survey is now being distributed. So obviously that's only as good as the data that we get to put into the survey. So please do email workinggroups@phuse.eu if you're willing to participate in that survey. And the communications and promotion and education projects have created a code repository front end for our FHUSE education page. So as well as providing important educational material, the code repository also provides a front end for all the packages that are mentioned in FHUSE final deliverables. So it's well worth taking a look at. And then finally, a few final reminders. Our next webinar is going to be on the 20th of November. The agenda and registration details will follow in the next few weeks. And please do sign up for the FHUSE blogs for all the latest news about events, working groups, and membership. So with that, I'm now going to hand over to our first presenter, which is Michael Harris, who's going to talk about the FHUSE EU Connect, which is starting in a couple of weeks' time. So over to you, Michael.
Thank you, John. Can I just check, can you see my screen?
Yes. Yeah, I can see it.
Okay, okay, great. So I'm Michael Harris, the EU Connect Chair for 2019 from BioMarin. So we've got 2 weeks to go. I can't believe it's come around so quickly. For those of you who have registered, I'd like to remind you of what's going to be on offer. And for those of you who are undecided, hopefully this will encourage you to attend. So we have 3 keynotes, which I'll talk about shortly. There's over 180 unique presentations across 18 streams. There's 2 social events. On the Sunday, you've got the poster session and welcome drinks. And on Monday, you have the conference dinner, giving you opportunities to catch up with old friends and to make some new ones. There's going to be there are over 40 exhibitors and sponsors. There are 4 hands-on workshops and an EMA discussion club, which require registration. So please contact events@phuse.eu to process your registration. The hands-on workshops are on programming in SAS Fire. So this is a workshop. This workshop is designed to help an existing SAS programmer understand the features of the SAS Fire environment. We've got Let's Make a Knowledge Graph. It's an interactive LinkedIn data experience. We've got Insight into Python, which is an introduction to Python. And then we've also got Deep Learning for Humans, which is an overview of deep learning and the underlying machine learning concepts. We'll also have a discussion club, which we feature in the EMA. So that's going to be on data transparency, which will look at the current efforts from regulators and other organisations to enable data sharing. And the EMA are going to give a status update on Policy 70, and it'll be followed by Q&A and panel discussion. So back to the keynotes. So we've got 3 exciting keynotes. We've got Elsa, who's going to talk about digital biology, the next software revolution is life itself. So it's going to be examining how the operating systems of life is rapidly transforming the world around us, including ourselves, and discovering how to inspire the bold moonshot visions that accelerate disruptive innovation in the health sector. We've got Dr. Neil Stanley, who's going to be talking about sleep and the ways of measuring it, which pretty much sums up his keynote, but it will cover how to effectively measure sleep clinical trials and why big data is not always the best answer, and the challenges of new technology, illustrating the perils and pitfalls of measuring sleep on clinical trials. There will also be a follow-up session towards the end of the conference. And on the Wednesday, we have Simon Shepherd, who's going to talk about the data of fluffy stuff and the battle for sanity. So Simon's talk will explore why organisations are realising that people are important, and we'll look at data points which will match physiological responses to human behaviour to get people thinking about their key human performance indicators. There will be an opportunity to be part of the keynote, so please engage. Can you complete a brief questionnaire of the energy and performance profiler? There's a link in the activity feed of the app. So as always, we have the poster session. So just to remind you, we're actually going to have 2 this year. There is the poster session on the Sunday evening and the drinks reception. And then there's going to be 1 on the Tuesday, which is an additional catch-up. And if you are undecided on which posters to look at, or you'd like to hear from the authors themselves, then please take a look at the poster teasers. So they're a 30-second soundbite from the authors giving an overview of their works of art. This should give you an insight and help you target the posters that you wish to see ahead of the conference. A link to the poster teasers will be sent out prior to the conference, and I'm pretty sure you'll see a link and lots of promotion on the app. So new streams for 2019, which this year we're going to have 3 new ones, and they're going to be dual formatted. So that means there's going to be a presentation element to them and hands-on session. So that's kind of a first for the conference. So we're going to have the professional development, leadership and innovation, and personnel management. So the professional development hands-on session is putting ourselves under the microscope, exploring professional identity and well-being, and impacts for career development. So the aim of this session is to capture ideas for growth and development and to explore opportunities and difficulties that may act as barriers and for enablers to your onward career trajectory. So the session is going to be broken down into 3 parts, using academic theory and interactive exercises. The leadership and innovation is going to be a follow-up from Neil on the keynote. And this session will just this session will comprise of group breakouts, group feedbacks, and the session wrap up. And then the personnel management will be around the use of the 9-box tool to identify high performers, candidates ready for promotion, as well as underperformers, and for them to use this information to put succession plans in place using fictitious profiles of team members. I can see this one being quite amusing. And just to point out, registration isn't required for these sessions. So as John mentioned at the start about the new app, so we're going to have the conference at your fingertips, as it were. So through this app, you can see the full schedule, including abstracts and speaker profiles. You can sort of personalize your own agenda, so work out what you want to see. You can also connect with speakers and attendees through posting and direct messaging, and you can also view the exhibitors and sponsor profiles along with their stand positions on the new interactive map. The app itself has a similar feel to Facebook or LinkedIn, and it includes gamification, so you're awarded points for your activity in the app. So for example, if you happen to post something or like something, you'll be awarded points, and with all good games, points mean prizes. So just to point out, or just to reiterate, sorry, that this is only available for those who have registered for the conference, and you can download the app from the iOS store or Android. So onto my final slide. Just last words really just to say, I look forward to meeting you, seeing you, and I really hope you enjoy the conference. So final words really are to see you in Amsterdam, and over to Beate.
Thanks a lot, Michael. So I'm happy that I do have some time together with Brigitte to talk a little bit about a newly introduced project. So as of today, I do have my PHUSE hat on. So I'm the PHUSE Education Director, and for a long time. And I talked with Brigitte a lot about this. We were thinking that there is a need of kind of finding information about topics fairly easily. And then Brigitte and I did a lot of preparatory work to for this project, and we would like to introduce our ideas to the community, and we are hoping for people joining us to make this going and being successful. So what we were thinking is that when we're working in the industry, either as a programmer or a statistician or a data manager, luckily it's a very colorful job. So it's not the same all day. It's a lot of topics we need to tackle, and it's so much information that you might need, and so many topics. It's not just some technical skills to know a little SAS programming. It's much more than that. And Brigitte will talk about what we thought as an outline in a minute. And this is where we thought if we had a repository where you would have a quick reference guide just for everybody working in the industry. It's not tailored just for those people joining the industry newly, but just for everybody. But because you might not have seen specific topics in your programmers or statisticians life for quite a while, but then, well, at some point you might be involved, for example, in unblinding a study, what you have not done before. And this is where we thought if we had a quick reference guide and a repository, that might help the community. So, and we were thinking that the repository should then be a part of the education website, which is already there, and there are other topics as well. And we think we would try to identify recent materials from publications or regulations and refer to those, and organized in a user-friendly structure so that people can find what they're searching for. As far as Brigitte got, we were identifying 4 different subgroups who can work on specific topics, and once ready, then the information, the links to the information would be uploaded to the Squarespace area. Over to Brigitte.
Thank you, Beate. So what are the 8 different subgroups we were talking about, Beate was talking about on the previous slide? It goes from the drug development process, covering the different phases, the submission process, what is a clinical development plan. The next topic will be the clinical study design and conduct, collecting information about study methodology, study design. We would like to collect something about the clinical study workflow, information from study planning to the CSR at the end. What are the most important clinical documents? For example, what is a clinical study protocol? What is a data cleaning plan, etc. The regulatory environment, what is ICH E6? What are the most worldwide, the most important regulatory agencies? So the programming, we would like to collect some information, but yeah, about SAS, about R, Python, data visualization. The next topic will be data standards, CDISC, what are the most common coding dictionaries, and last but not least, the therapeutic areas. We have already a FHUSE wiki about a lot of indications. We would like to go through it, what is missing. Maybe we can add some indications here together with the team. These are the 8 subgroups we were talking about. We would like to cover in the group. It is not written in stone, so maybe that we will cover some other missing topics. So the list it's open for changes or additions, but at least it should be the start. Next, yeah.
Yeah. So what we are aiming to is that we cover those topics who are relevant for everybody's current work and requirements, and that people can easily find up-to-date information at a glance. I guess it will be quite a challenge, and there will be, well, maybe there will be discussions how we best do that, but yeah, maybe there are people out there who are eager to help us there. And what we would like to do is to link to FHUSE material, what's already there, because in FHUSE there is so much we did over the last 15 years. So there's a lot there what's up to date. So we would find links to the wiki, to papers and presentations, of which we have a lot and really excellent ones. Of course, to the FHUSE deliverables, to the FHUSE tube, and to the archive, wherever we find the best and suitable material. It would also include links to regulatory sources, as Brigitte said before, to most current industry standards, and to other publications, whatever fits best to the topic. And to make it more precise and clear, what we don't think is the aim of the group is to really create training material. So we rather would just reference to already existing sources. So we also are not aiming to create new documents produced by the project team or the sub-teams. So because during the process we might identify topics for which we might not find any suitable sources. But then we would rather try to go back to the society and initiate other projects who would look into those. And our project would not cover topics which are already covered and very well covered by the initiative of Educating for the Future.
So after getting all this information, if you are excited about the project, and I really hope that we will find a lot of volunteers, if you are keen to collaborate, if you will be available for regular team meetings, no more than fortnightly and no less than monthly, but there will be a little bit of work in between as well. If you have the time for it, and if you are interested to work in a global team, and it will be a global team, we have already volunteers from India and also from the US, so it will be a challenge to have meetings with each other. So we would very much appreciate your support. And what should you do if you would like to join, or at least if you have questions, please contact Beate or myself. And if you would like to join the project, then please contact Wendy. Wendy will give you access rights to our team page and will manage everything regarding the meeting invites, etc.
So, and what we're planning to do next. Luckily, we also have the FUSE EU Connect coming soon, as we heard from Michael. And of course, we're going to talk about the project at the conference, Brigitte and I, and we would be glad if others would join us in doing so. We are then planning a kickoff meeting with the whole group around end of November this year, and then also subsequently build the team and the sub-teams in December. And well, we are hoping that for at least one of the sub-teams that we would have some deliverables available already in Squarespace published by the end of the first quarter next year. So we are really now waiting for your responses, and also any other feedback or ideas you might have and you would like to share with Brigitte and me, please don't hesitate to touch base. And with that, I'm happy to hand over to Zach and Mary.
Thank you. This is Zach Skrivanek speaking. And Mary is with us too. Mary, you want to say hi?
Hello.
I'd like to
I'm
share
Mary
my
Nilsson.
slide. Very good, thanks. Yeah.
If you could just put the presentation in presenter mode, Zach, that would be great.
Okay. So
Perfect.
Like the screen, are you able to see my screen?
Yes, that's great.
Okay, very good. Okay, and so I and Sharon Liu are co-leads for a sub-project called Interactive Data Visualization for Decision-Making Submissions. And we're all part of the working group, Emerging Trends and Technology Working Group. Mary Nilsson is also part of this working group and project team, and she is also co-leading an internal effort that is basically parallel with the FUSE group and facilitating POCs and pilots led by Lilly as part of the FUSE initiative to provide interactive data visualizations for decision making. Today, I would like to talk about briefly about the backgrounds and the goals of this working group. And then I'd like to share some approaches that we've considered for achieving this goal of providing interactive data visualizations with automated analyses as part of submissions. And then we'll go over a POC and pilot. And this POC and pilot were done in collaboration with other members of our internal FDA Pilot group Those members have joined our meeting. I just wanted to mention their names: Todd Jerrig and David Adams. Todd was involved with the POC and the pilot for providing the material through the global review submission process. And David Adams is the lead clinical research scientist who was who led the trial, and we worked with him to include this interactive data visualization, which we will talk about today. And then after we describe the POC and pilot, then I'll just mention some next steps and entertain any questions that people might have. So the goals of this working group is really to advance drug development in how we share information with our regulatory agencies. And it's really in the spirit of what Janet Woodcock had called getting away from digitized paper. She published this in a pink sheet, I think, last year. And it's to me, this is really part of that effort. This is how we do this. Currently, we've gone away from shipping truckloads of paper, and I do mean that seriously. There's people that should be familiar with this. That if you actually printed out our submissions, which we used to do in the past, it would actually fill. I think in Europe you'd call a lorry, and in the United States we call it semi-truck. But we're talking about, if we print out every single TFL and every single piece of writing for a submission, it actually fills up a truck, from front to bottom and back to front, and sometimes more than one truck. And that's an enormous amount of data. At that point, it's not really data. It's not really information. We're just dumping. And I think it's really conceivable that anyone could possibly go through all that data. Now we've done electronic submissions, but we haven't really leveraged the potential of currently available technology to improve how we share information through electronic submissions. We basically have, as Janet Woodcock says, just digitized paper. We basically have taken paper and we just have an image of it now, a PDF image. And the only thing that we've really done systematically to improve and leverage technology currently exists in terms of how we understand the data and share the information is now we have hyperlinks. And you can go to the table of contents and you can have hyperlinks. You can go right to the section that you want, and that's really great. That's powerful. But the purpose of this work group is to go beyond hyperlinks. And so the idea is through interactive analyses, we will have quick insights and we'll streamline the process to make more efficient decision making. This should also be shared with regulatory agencies. And here we're focusing on the FDA, but there's no reason we want to expand this to all of regulatory agencies. This is just we figure if we can be successful with the FDA, we think that we can be successful everywhere. And so we want to start off by first providing this interactive data visualization as a supplement to what's already typical in any interaction with regulatory agencies, whether that's a briefing document or submission, whatever it is. That will, we presume, make it easier to transform how we do drug development. And eventually, we would see that maybe we don't need these static TFLs anymore, or as many. Maybe we can actually achieve everything we need with these interactive data visualizations. But in the short term, that's not the goal. In the short term, it's just a supplement to enhance. And so we're not claiming that we're going any further than that, but we would eventually like to go even further. And so now I will talk about approaches considered. And so one approach considered was to give the FDA access to web server. And here and it could be eventually it'd be beyond the FDA, to any any regulatory agency. And the idea is that it would be behind the company's firewall, and you give the username and password, and the regulatory agency could just access it. And that raised a number of concerns. One concern was raised with their FDA counterparts that they weren't sure if they would really want to get behind another company's firewall, because that might raise ethical concerns. It might be unintentional, but it could make it it might even be by parents, for instance. And then there was concerns that maybe a lot of companies wouldn't want to do this, want to give this access, so they might be concerned about giving this access. So that just raised, there were some challenges that were raised behind that. Another proposal was, well, we could have the FDA host a platform, and there was a couple problems with that. One was cost and money. The other is that the FDA, and then to counter that, one proposal was, well, a sponsor could pay for it, but then it might look like a gift, so that raises ethical issues, and that's a challenge. And then the other challenge is that the FDA might not necessarily want to host this, and they might not have the time or capacity to do this. And so to mitigate against that, and against these two approaches, and against the hurdles that came up with both approaches, then another proposal was to look at a third-party server. And in fact, this is still, I think, this in particular is probably still quite feasible. But one of the concerns with all three of these approaches, frankly, is that there is going to the regulatory agencies. First of all, even if we had one of these three proposals in effect, the regulatory agencies don't want to have to learn a new tool for every single company and every single submission that a company does, for instance, or every single time they interact with a different company. They want to have some sort of common, they don't want to be overwhelmed by having to learn new tools. The other problem with this third one in particular is it has to be, and actually the third one and first one is that we need to ensure the integrity of the data and of the analytics that were done on that data for indefinite amount of time. Maybe 10 years after there was this interaction, maybe 10 years later, there might be a line extension, and the regulatory agency might need to see that data as it was, and they need to make sure that nothing had changed during that whole time. And so that, that creates, other challenges. And some of it is just, could be solved by, having some sort of contractual guarantee that it's there for an indefinite amount of time. But that's to be seen yet. There's no easy solution. And excuse me. And so the fourth approach, we're kind of whittling down to a fourth approach is to provide a containerized app to regulatory agencies, and they can host it on a virtual machine. And that's certainly a technologically viable approach. This solves the issue of it being behind the regulatory agency's firewall, because then they don't have to, then they control it and they own it, and so they don't have to worry about the integrity being over time. They can make sure it stays intact. One of the challenges is it's still it would still take time and money for the regulatory agencies to host it, and each regulatory agency would have to do this for if they wanted to look at this interactive data visualization. And so now we get to the last approach, which is the approach that we actually have piloted. And I don't think just because we are piloting this last approach, the reason it doesn't mean that we are ignoring the first four approaches. There are advantages and disadvantages of the first four. The point of this is just to show that we've thought about it, we're investigating it. Probably the third and fourth one listed here, we're actively pursuing. The first two, I don't think we're actively pursuing, or anyone's actively pursuing that I'm aware of. but I don't think they are necessarily impossible, but there are challenges with them. Bringing up the challenge I mentioned earlier about having a common user interface and having to learn new tools. Well, that's a challenge in general with any of these. That goes beyond just technology. That's more has to do with user interface and human-computer interaction, and so to go to start off with this project and to avoid those issues, we want to start off with something really, really simple that you don't need to learn how to use this interactive visualization. It's so intuitive. Just people using, interacting, doing their daily work, and using the internet and using websites should be quite comfortable doing. Was the goal to first introduce this concept of using interactive data visualizations as part of drug submission. And so this last one is what we piloted most recently, and this one here we call it interactive display. And so we're really focusing on, we're using the word display instead of tool to really emphasize that we want it so intuitive that you really shouldn't have to, it really should be kind of intuitive just how to use. It's just like when you do a Google search, you don't have to read instructions, you just start typing, you just kind of get it very quickly. And that would hopefully make it easier for consumption, make it quicker for the regulatory agencies to use. And by using a standalone HTML, we avoid the necessity to have a server. We avoid the necessity to have a virtual machine. And the only thing that anyone needs to read an HTML file is a modern browser. And so we're assuming that regulatory agencies have modern browsers. They're freely available, and with the modern browser, you can do a lot still with an HTML interactive display. And so that's what we're going to talk about. And so before we actually piloted this with real data, we wanted to do a proof of concept just to make sure that there weren't any technological roadblocks that we would run into. We studied the global review submission process, and we thought that it should be feasible to do this, but we wanted to make sure that it was before we actually included it, did it with the real data. And so we went through the e-submission process, and we got a sample application number, and we generated some fake data, just completely simulated data. And we created a cover letter, a fake CSR, and the CSR had a hyperlink in it, and the hyperlink went to a volcano plot, which I'll show in a little bit. And we also want to see if the submission could handle an MP4 file, an animation of simulated clinical data. And so we generated these contents, and we submitted it through the e-submission process, and that was in April. And then in May, we met with the reviewer, if you will, the reviewer for the fake data, who received it on the FDA side, and we went over it, and we verified that the technology worked. One of the things that we learned, that even in spite of putting in the cover letter that you must use a modern browser that is HTML5 compliant. That's the one caveat. It has to be a modern browser to work. The reviewer invariably just clicked on the link, and the default for the reviewer was to use Internet Explorer, which is not a modern browser. It's not HTML5 compliant. So then we had to say, hey, you have to use a modern browser. And it's just another, it just confirms my long-standing belief that users in general, they don't read instructions. And so we try to make it so easy that you don't have to read instructions. And sometimes, it's impossible, but that's just a little side comment there. Yeah. And so now let's talk about the pilot, okay? So in the pilot, here we actually did included this in a real submission. I don't want to talk about or I can't really talk about the details of, what the submission is for, what the indication was. And that's not really relevant for the purpose of this disclosure. But the point is, we did do this with the real submission. It was this year. We'll disclose that, and we kind of replicated what we did in the POC, where we had a cover letter to explain that there was that this was part of the FUSE initiative, and that this is a little bit different than what people might be used to. And we included it in the summary of safety instead of in the associated with the CSR. So that's where we deviated from the POC, and that was probably a more appropriate place to put it, because what we did is we had an interactive data visualization of all of the safety data, and so we did a volcano plot, and this basically was equivalent to summarizing, and I think I might have made a typo here. I think it's actually two 39-page tables. I don't think it was 29. I think it was 39. But anyways, it was a number of a lot of tables, a lot of pages of tables were basically reduced to a single interactive data visualization. Whoops. And so I wanted to just show you what it looked like using fake data. And this is fake data right here. This is just a GIF, okay? And it's all fake data. And emphasize, I'm not showing real data. And the point of this demo isn't to say that this is the ultimate interactive data visualization, but it is to say that it's better than 78 pages of tables. This is equivalent to the 78 pages of tables, where you can get all the information that you need in this one interactive data visualization. You can hover over and you can see what the adverse event is. You can see the odds ratio and the p-value. You can see the statistical low dose, placebo. You can look at different comparisons. You can look at different system organ classes. And when you think about it, if there's other things that were of interest, like we want to look at just a special SAE group, then you can obviously include that in this visualization. It's not limited. If we want to drill down, look at patient profiles, that's possible. So the point isn't that this is the end all be all of all interactive data visualizations. The point is this is better than two 39-page tables, and it's how we can further enhance how we provide information in our submissions. And so I'll pause right here before I talk about next steps. Are there any questions or comments?
No questions or comments so far. Okay.
And so then I'll just wrap up with the next steps. And so in terms of for this sub-project team, the next immediate steps are that we will Lilly will participate in piloting more of these HTML approaches to provide interactive data visualizations with regulatory agencies. Roche Genentech, led by Sharon, who's part of this working group, part of the sub-project team, leading the sub-project team, her company is piloting the inclusion of an R-Shiny app in regulatory communication using containerization. And so this was that fourth method, the one before this HTML method that I had mentioned. So these are current most immediate piloting efforts. And that's the conclusion of my talk.
Thank you. We're going to hand over to Hanming now.
Hello.
Hello.
Okay. Can you all see my screen?
Yeah.
Okay. Minimize that. Hi, my name is Hanming Tu. I'm the co-lead for the project called the Code Sharing Project in Standard Analysis and the Code Sharing Working Group. So today I'm just give an update on one of the projects that we did the sub-project in our team. So I'm going to give a little bit of background, and then why we want to create a TS domain, and how did we do that, and then in the end we'll give you a quick demo on what we did. So the code sharing project in our working group basically try to create a script repository. Right now it's in GitHub. Some of that, if you access to that, you will find that we already have some scripts that either we developed or some contributor contributed into the repository, and they're hosted in the repository. And then we have create the script metadata to describe some of the script in the repository. And then we have another team develop the test data and host in there as well. And then we have some other like R, Spotify script in the separate area as well. There's some other group that are working and develop some script that we hosted it as well. So if you want to find out lots of things about our project, you probably can go to GitHub repository. We also create like standard script web page that's hosted in the PHUSE website. If you go there, there's a little bit more detailed description about this project. But today, one of the projects we did is to create a simplified TS domain. The study data technical conformance guide that described when you need to submit a simplified, so when you need to provide the full TS domain data set, and actually describe all the parameters needed for the full TS domain. So this is kind of required for some of the situation, but based on the technical rejection criteria, if you do not include that domain, and your submission may get rejected. So actually in that, in the technical rejection criteria, there's typical findings that find us that some of that they don't have even have simplified TS. And I think based on the recent report, probably over 1/3 of their submission were rejected because of they don't have a TS domain in it. But simplified TS was very simple, but some of the company, especially for those non-clinical, that they don't know what is needed in the TS domain. But it's actually very simple. Based on that, we working with FDA and created the tool that will help to develop that. So some of the party know that simplified TS domains only need document the study ID, the study date, and those are the things that only 4 variables, and for those is actually required, so that will allow FDA to determine whether the study data is what is required to be in the city standard format or not. So those are the 4 variable in the required simplified TS domain, and it's all based on whether it's a clinical or non-clinical. There will be different values needed. So actually, FDA has published a very detailed requirement on this. So I will show you that in the demo. So basically, this is the example of the TS simplified domain data set variables, and some of the examples now. If it's clinical, what would it look like? If it's non-clinical. And then based on the FDA technical rejection criteria, so if you look at the number there, there are quite a lot of submissions were rejected because of lack of TS domain data set. I think this is a 2019 report from FDA. So this actually is published on FDA's website. So after we got the requirement from FDA, so we started developing that. So what the tool that we use is using RShiny, and we have developed a PHUSE package actually. So this application kind of embedded in that package. So that's that's information that if you want to get the RFuse package, there's two ways you can get it. You can get it from the comprehensive R archive network, basically the crime. So just do the use the install package FHUSE, you will get that. If you want to get the latest version of, we'll continue to work on those. Some of the latest may not be published into the CRAM, but you can use the install package dev tools, then get that from repository directly. And how to use it is very, very simple. You just library basically load that package into your RStudio, and then just start FHUSE. That will start the whole work application framework. But if you want to start a specific package, you indicate use the number. So I will show you a little bit more on that. So, but the application actually is used as an example in this package. So this one is the number 7. So here that you can see the published version is already in the Shiny app hosting place. We are in the process of trying to find a permanent hosting place. Because Shiny app, what I have is like free account, so there's a limited data volume that you can use. So I'm going to go there to show you what this app looks like. So this is the app. Right now it's published, the shinyapp.io. And once you start this, it's a very simple interface. It's web-based. So what you need is you just need to provide a study ID. It's maybe ABC, whatever the study ID you have. And then you need to choose what type of parameter, either non-clinical or clinical. And then based on this, if you have an exception code, then you don't need to provide the study date. So that if we, if I give some code there, the data study data has got moved, and you can view your data, right? And if it's looking okay, you can come back and you can download it into a XPT file. This is in the SAS transporter file format. Okay, and let's say if you have the data, you want to put the date, but if you put the data, you don't need to provide the code. That's based on those rules that define in those simplified TS domain. And then if we look at this, okay, you can download. So it's very simple to use. And I have included some information here that if you want to get the package, basically this is one of the slides that I show you there. So let me see. If you want to look at the creation guide, I included here as well. That has detailed information defined what are needed, whether you can want to create it in R or you use in Python. So this is the example we use on R Shiny, and we created this. So the detailed requirement actually in this document, and you can look at and we work with FDA. I give first version. They have some feedback based on that, so we have finalized. So this is the kind of finalized version. If you are really interested in R and R Shiny, you can look at the source code here. So this is the source code. Okay, so this is not like a very complicated application. So it's only about 200 lines. I think that's all I need to present. I can. Okay, that's all I need to present today.
Thank you, Hanming.
Great, thanks, Hanming. So I think we already had some questions, right, for Zach and Mary. But if anyone else has any questions, then please type them into the chat, and we'll try to get some of them answered in the short time we've got left. So Mary, Zach, do you have?
Yeah, I see the question. Can you make the POC submission package available for review? It's available for review. It is available for review by the FDA right now. It's a question to make it available to the whole public.
Yeah, the FUSE package is available to whole public, right? Yeah, anybody can download it because CRAM is open source, basically open to everybody.
I thought that was a question. Okay, I'm sorry, I answered the wrong question then.
Oh.
No, that question is for you, Zach.
Okay, it was to me. Okay, yeah, that's why I was confused when I heard that answer. Yeah, so again, this package is right now in the FDA's hands. Now, I think the question is probably saying, will you provide the code is for the volcano plots, to the public? I'm going to interpret the question that way, and the answer is that is the goal is to make an open source contribution of this data visualization, so that is the goal, yes, but without data, of course, and without the real data.
Okay, great. Thanks, Zach.
Sure.
So I think we're unfortunately we're out of time. I see people are starting to have to leave and go on to their next meetings. But I guess if anyone does have any additional questions for the panel today, then feel free to get in touch with them, and I'm sure they can provide you with any answers you're looking for. So it just remains for me to say thank you for joining today, and thanks especially to all our panelists for their presentations. It's much appreciated. Thank you very much, and see you all in Amsterdam.
Very good. Thank you.
Bye.
Bye.
Bye now.